What I find really exciting is I think healthcare was really stuck in the 20th century. Some would even say maybe in the 19th century for a long time. If you went into a doctor's office 5 years ago, you were given the clipboard as if you fell off the face of the moon. You filled out by memory what medications you took. There was no way of verifying it. Information wasn't exchanged. If you were a complicated patient, a diabetic who needed foot care and eye care and general care, somebody to monitor your blood pressure, it was up to you to coordinate that care, to get to the right person, to not let it fall through the cracks. That system is really changing. And I think that is good news. And technology will add a lot of pieces to that puzzle. Technology, I think, can help re-empower the primary care doctor to be the care coordinator, to actually monitor what's going on, to make sure that you don't run 15 of the same tests, that if you had an EKG run by this specialist, it gets sent automatically and becomes part of your chart. That just wasn't happening a few years ago.
That's true.
So you're saying these things are already happening?
Well, they're not happening fast enough, and they're certainly not happening to scale, but they're starting. One of the most, I think, interesting portions of the Affordable Care Act, which is not well talked about, is that for the first time, the Centers for Medicare and Medicaid Services, first of all, has a stream of research money. They've never had that before. And they're testing protocols for how to improve health care and at a minimum not raise costs, but ideally lower costs. What works? What's out there? Everything from accountable care organizations to paying for bundled care to helping make sure patients don't come back into the hospital too soon, that there's follow-up care. Some of those experiments are showing very promising results, but the most important thing is the law gives CMS the authority to put those in scale overnight, administratively. They don't go back and ask for permission from Congress.
Right.
This can move a lot faster than it's ever done before, and I think that's very good news.
I think one of the things we've learned over the years is economic incentives can drive change. And the new secretary would have to identify those economic incentives that can drive change. Sometimes there's simple things like, hey, we won't pay if someone got an infection and was readmitted to a hospital. You can't imagine the discussions on hospital board meetings about losing money if they're not careful about patient safety. And the kinds of things the Center for Medicare and Medicaid Services are doing, those kind of experimental things are key. But if we look at history, we extended life in this country with 3 or 4 things: sanitation, clean air, building codes, and vaccines. And I think that we know that we could drive down costs if we got Americans to exercise, to eat right, and not to smoke.
Yeah.
And if we would focus on some of the low tech with real investments, as opposed to just focusing on the high tech, meanwhile change the payment systems with economic incentives, that all of that would go a long way towards improving outcomes, making the system much more integrated and seamless, and we would have extraordinary outcomes in this country.
Dave.